the mindset for the applicant should be, how do I get myself accepted? How do I bring my alignment with the institution into view, make it apparent to the interviewer and to the committee that's reviewing me, so that they move me into that pile of acceptance, so that they see the ways in which the school would be a great fit for me.
Hello, everyone, and I am very excited because we have Dr. Ian Hagemann here, ready to tell us all about the application process of medical school. So I know that a lot of you guys are pre-meds and some are students, but it's okay to listen and kind of think about it because some of this can be applicable to when you're applying for residency. So we're going to have a fun chat. So I'm just going to ask you to start by telling us a little bit about yourself.
Sure. So first of all, I'm really glad to be here. So thanks for the opportunity. My name's Ian Hagemann. I am a member of the faculty at Washington University School of Medicine in St. Louis, Missouri. And I've been here for 23 years. I came as a medical student, and then I stayed on while I did MD, PhD training, and then went away to the University of Pennsylvania for my pathology residency, and then bounced back to WashU for a faculty position and a couple of fellowships. So I've been here for a long time and seen the institution through a lot of changes, and it's a great place to be. And we can definitely talk a little bit about the institution, but I know that everyone wants to hear about the application process in general. And just kind of going back a little bit further, I was originally, I'm from the Washington, D.C. area, Northern Virginia. One thing that's a little unusual is that my father is French-American, and we lived in France for about 9 years when I was growing up, off and on. So I did sort of elementary school, and then the years that I was in college, my parents were living in Paris, France for all of that time. So that was a great place to be a young person, and really formative, helped me to be a little bit more of a world citizen and build some language skills. So I still try to keep up with that part of my life. In terms of professional development, as I mentioned, I went through the MD PhD program. I got interested in anatomic pathology as my specialty, and specifically I do gynecologic, breast, and molecular pathology. Those are my three areas. So our job is primarily diagnostic. We help clinicians, which is our term for anyone who's not a pathologist, to understand what disease processes are present in their patients and how bad they are and whether they got it all out, so that they can make appropriate treatment decisions. So you have to understand clinical medicine, but you also get to use a lot of technology and new techniques and methods to pull information out of the specimens and help guide patient care to get better outcomes for our patients. So I really like what I do, and always happy to share with people about careers in pathology. The final little piece, you may be wondering how I got involved in medical school admissions. Admissions changed my life in the sense that I was accepted to WashU and had the opportunity to come here. And I volunteered for the admissions committee when I came on faculty, and I'd say one thing led to another as different opportunities came available. So today I'm the assistant dean for admissions at WashU.
That's an amazing story. And I love how you talked about how your life has brought you to different realms where you can kind of practice the languages, you live abroad, and all of those things that are very interesting and have definitely probably impacted the way that you work in healthcare and help people. I love that you also mentioned about your specialty, pathology, because I always say that pathologists and radiologists are the people who definitely help to bring out those medical mysteries and help us, people who are talking to the patients, actually figure out what's going on with the patient. So we need you, and it's amazing. I definitely wish that there were more opportunities in the medical curriculum, although we know that it's pretty packed, to have everyone kind of rotate through pathology.
Yeah. It used to be a bigger part of the medical curriculum, and of course, things have gotten more complicated. There's a lot that we want to add. A lot of residency programs, especially in surgical specialties, used to have either a month or 3 months of pathology. That's gotten a little bit lost over the time. I've got to say, having rotated through general surgery and OBGYN and pediatrics sure helped me to be a better pathologist. So I'd like to think that spending even one day or one morning in pathology could be helpful. Talk to to your pathologist and set it up. Depending on what stage of training you're at, it's often possible to just observe for a day. And during that day, you'll see how the specimens flow through the system and what it's like to make a diagnosis and how the communication flows within the team. And it can be really, really enlightening at any stage of training.
Absolutely. And that's a great point that you bring up, because a lot of times, especially in the fourth year or when you're first starting in your kind of years where you're doing a bit more of the reading component, the preclinical years, you have the opportunity to kind of go and shadow, ask questions and things like that. And sometimes you may actually realize that it may be something that you want to pursue. So I know that I had one of my friends who wasn't too sure what she wanted to do. And then she went she really liked anatomy, and she went and shadowed the pathologist and ended up taking a fourth year elective. And now she's a pathologist who actually is a forensic pathologist. So she travels all around, including to the islands and all of those things every week to kind of help with cases. So there's lots of cool pathways that you can come about by just exploring things.
Yeah. There's a lot of diversity within pathology in lots of different ways. I mean, very diverse people, but also diverse subject matter. So surgical pathology and cytopathology and autopsy and forensics are all very different from more of the laboratory medicine, like transfusion medicine and molecular pathology, clinical chemistry, microbiology. Those are all worlds unto themselves. Those are all subspecialties that you can go into. So choosing a career in pathology, kind of like any other specialty, there's a lot of subspecialties within them, but in pathology, they're very different from each other. And I appreciate that, because it can be a way of, delaying the decision a little bit. If you're a person that likes a lot of different things, you know that there's going to be lots of different things on the buffet menu in your pathology training.
Absolutely. So you mentioned another hat that you wear is in the admissions office. And for the listeners out there who've been listening to us for a while, or at least the past few months, you may notice that a lot of our guests have been talking about different components of the admissions process, interviewing, choosing what places to apply to, how to apply. But I think it would be interesting for us to chat a little bit about like what happens after you apply to medical school. Like, what's the next step once they've started looking at your applications and things?
Yeah. So I know that there's a lot of speculation about the behind the scenes. People used to call it Kremlinology, trying to figure out what's happening behind the Iron Curtain. Every school is going to have a little bit of a different approach. So just as a disclaimer, I'll say that I'm going to tell you what I think are some of the generalities, and then every school might do things a little bit differently. But the first thing you've got to understand about what happens once you submit your application is that almost all medical schools in the United States work with AMCAS, the American Medical College Application Service. So you apply initially through them. It's kind of like the common application. You put together a portfolio that's got your grades and transcripts that you enter in. Experiences, you can enter up to 16 experiences in different categories. There's a personal statement, there's demographic questions. You submit all this information and pay a chunk of change, make a list of schools, give them that list. And AMCAS does a little pre-processing. They verify grades to an extent, and they convert grades from different grading systems into a standardized scale and GPA so that applicants are evaluated on as close to a level playing field as possible from a grade point average perspective. If you look at the applicant packet, you'll see that they've put a lot of thought into figuring out how are we going to crosswalk from different grading systems. So some colleges, give an A plus, and some the top grade is A. Some give minuses, some don't. Some have a grade called AB. Some have semester systems, some have trimesters, some have one class at a time, like a block system. And AMCAS has a way of crosswalking all of those grades into what they think is a reasonable approximation of fairness, so that it's a little bit standardized. So they process, they also collect letters of recommendation and process them into a packet, and then those are sent on to the schools. And they're supposed to come down to us tomorrow, actually. So July 1st is the day that we normally get any applications that so the AMCAS application opens for submission in June, and then on July 1st, we'll start to get a big batch of applications sent down to us. All of the medical schools have some type of portal that they use. There's one that AMCAS provides, or they may use their own. There's a couple of different vendors that provide kind of like a database for tracking the applications. And then the fun begins locally at each of the schools. A review process kind of gets started that's going to last until the end of the season. So anything you want to hear more about that process so far?
I think that you gave a great behind the scenes that they kind of correlate what is going on and how to make the grades kind of make sense and make it a little more equal for everyone. And then you guys get in and you have to sift through it. So how do you review all of these different applications that I'm sure you guys are coming across?
Yeah. So step one for us is making sure the applications are complete. Now, coming from AMCAS, they're complete from their perspective. They don't have big missing pieces. But every school has a little bit of a different requirement. For example, we expect that letters of recommendation are going to be on letterhead. They can't be just emails. They can be handwritten, but they have to be on some kind of letterhead. They have to be signed by the letter writer. So we check all of them. Sometimes we have to circle back. That's not an AMCAS requirement. That's a WashU requirement. And we look through and just make sure that there weren't any errors in data transmission. Maybe there's at least a small chance that some document got replaced by a blank or something like that. Mm-hmm. We want to make sure that we have a completed application for each applicant. The other thing that we do at that stage is we send out our secondary application. So some schools have a screening process and they only send a secondary to certain applicants. We send our secondary to everyone. And so I think that's a good way to do it. I think it's a fair way to do it because the reason we do it that way, it gives every applicant the opportunity to show their strengths to us. We don't want to screen anyone out prematurely. We're not selecting our applicants just based on numerical factors. So I just can't imagine what factors we would use at this early screening stage. So if you send us an application through AMCAS, we're happy to send you a supplemental application, and we ask you to turn that around relatively quickly. Our recommendation is to send it in within a couple of weeks. The deadline is actually early December at WashU, so you can apply up through early December. You've got as much time as you need, but realize that at the start of the season, we've got more slots to fill. So as that season gets later and later, we have fewer slots available. So there is in medical school an advantage for those who apply earlier. So if I had to give some advice to your listeners, it would be to apply early, not before you're ready, but don't delay just for the sake of delay. Don't procrastinate. It's really important to get those applications in early when there's still the most number of seats available to you. So we send out the secondaries. There's also an application fee that's associated with the secondary. At our school, it's $100. We do offer waivers. Anyone who's gotten a fee waiver from AMCAS through their fee assistance program will automatically get a waiver from WashU for their secondary. And if there's someone that it's really a hardship, even though they might not have received an AMCAS fee waiver, just talk to us and we can probably do something about that. So this actually raises a couple of issues. One is that it's expensive to apply to medical school because you've got to put together this whole completed application, and acquiring all the experiences and coursework, and MCAT, and all the things you need to be a great applicant might have some expense associated with it. The application itself has a charge. There's a fee waiver, but it still takes you some time to put it together, and time is money. You've got to be able to block off enough time to complete this pretty complicated thing. And then the secondaries, and each of them has a possible fee associated with it. But we have a fee waiver program, and so we hope that no one will be discouraged because of the application fee from applying to our school or any of the other schools that they want to apply to. Most applicants today, I don't have these numbers at my fingertip, but tend to apply to a lot of schools. I mean, we're talking 20s and 30s and 40s number of schools. It can be a little hard to know how your application is going to be received. So I think that's why applicants tend to choose a lot of different schools so that they can kind of see where in the spectrum of selectivity their application is going to find the most success. So in terms of how we process them, once we get secondaries back, we check again that they're complete. And then every school has some type of rating or review process, kind of like an initial round. And usually it's qualitative and quantitative. So students will be scored in some way on some kind of rubric. And if you do your homework, you can understand or learn what a school is looking for. So we talk about our selection criteria on our website, and most schools do give a sense of what their heuristic is. By heuristic, I mean, what kind of reasoning are they using? So if you look at some of our colleagues at state institutions, they may have a heavy emphasis on training physicians who want to work in that state. So, if that's not you, you might not meet the criteria for that. You might be screened out despite having an awesome application. We don't have anything like that. We're looking to train academic leaders in medicine, students who are very curious, who are high achieving, who are motivated, who are very giving. We actually use the AAMC core competencies as our overall heuristic. And if you do a Google search for the AAMC or AAMC core competencies for entering medical students, you'll see a nice list of 15 criteria, skills, competencies that are exactly what we use to screen our applicants, trying to find students who show the most promise in those areas. So that puts students in kind of an initial order. Why do we need them in an order of some kind? Well, it's because we want to interview a bunch. We want to interview maybe 1,000 people, and we can't interview everyone all at once. And we can't interview absolutely everyone who applied to us because there's just too many applicants. So we're going to start with the students who seem to have the most alignment with our mission and vision. And then we're going to send out interview invitations until we don't have any more slots. And then unfortunately, we'll have to stop, even though we'd like to meet with everyone. There's a limit to how many interviews we can fit in just from the constraints of time and the interviewers that we have. So that's what we call the rating step of kind of the first stage of evaluating our applicants. And the students who were closest to the institutional mission and vision did the best at the rating scale step will be the first to be invited for an interview. At our school, we interview starting in late September, and we usually go through the end of February. So we'll send out invitations, interview about 10 people per day. We actually interview every day at WashU. Some schools have a set number of interview days, or they interview only on Fridays. We do it every day of the week. So it's really hard for our application staff. They're heroes in welcoming our applicants every day. Now, it is virtual now, where we're still doing virtual interviews. That's a whole discussion that we could have. But still, making sure everyone feels welcomed and has a good experience on their interview day is really important to us.
I love that you took that step-by-step approach to kind of walk us through, and it makes a lot of sense because, one, you have to figure out how to put yourself in the best light, of course, with all of the wonderful applicants who are applying. So there are thousands, but you only have a select number of seats for each class. So unfortunately, even though some of you guys are amazing, you may not be able to get an interview at a particular school, or you may have to wait until the next season or something like that. So making sure that you're following all of the instructions is very important, because you don't want to be put aside to maybe the wait list or the next round because you forgot something and you have to address it. So making sure you're complete is important. Also, just making sure that you're checking your emails and all of those things to stay on top of your P's and Q's is very important.
Yeah. No, that's a top tip to get a relatively easy, I wouldn't say advantage, but at least to maintain a leg up. You can get eyes on your application earlier and have the most chance of being offered an interview slot. Following the instructions, understanding the institution. Mm-hmm. Some schools actually don't entertain applications from outside of their state. We're a private institution, so we don't have any kind of in-state, out-of-state requirement. And we get a fair number of questions about whether we take out-of-state students. And absolutely, we don't have any kind of attention that we pay to that. But if you apply to a state school that doesn't take out-of-state students, then that's not a great use of your time. When I think about how applicants feel about this process, I realize that the possibility of rejection looms really large. Students really don't want to be rejected, don't really want to be waitlisted. What they want is to be accepted. And the thing that's a little funny to me is that we don't really think or talk very much about rejection at all. We actually don't really reject anyone. What does that mean? Well, we're in the business of accepting students. We're really excited about accepting every year a group of students that we think is going to thrive in our institution, help us to fulfill our mission and go on to become wonderful physicians. And we're really laser focused on those acceptances that we're going to make. Now, unfortunately, the flip side of only being able to make so many acceptances is that we're going to have to either waitlist or, to coin a phrase, not accept the remaining students. It feels a lot like a rejection, but it's not. It's usually not that the applicant did something wrong, right? There's a rare applicant in the pool who needs to be rejected because there's something that's really unacceptable about their file. But most applicants are really wonderful candidates. And so I think that the mindset for the applicant should be, how do I get myself accepted? How do I bring my alignment with the institution into view, make it apparent to the interviewer and to the committee that's reviewing me, so that they move me into that pile of acceptance, so that they see the ways in which the school would be a great fit for me, so that they see how I'm going to contribute to the community. In that way, rejection starts to be a little bit of a less prominent part of this process, even though, as I say, invariably the students who we are not able to accept, they do feel like they've been rejected, but it's not because they did something wrong.
How would you suggest someone who has not been accepted this round or yet prepare themselves if it were their reapplication for the next term? Typically, I know that we have the certain standards of where they have to have a certain GPA, the AMCAS scores, and all of that whole package, their volunteer, the things that make them you, and the things that, well, themselves, and then the things that kind of are in alignment. I love that you're saying with the mission of the institution, because you may not be a great fit for one school and you may be a perfect fit for another one, just looking at the mission, the patient population, all of those different things that comes together. So if someone finds themselves in a place where they were not accepted during this round, what are some tips that you could give to them to kind of highlight and get accepted the next time?
Of course, yeah. Yeah. You've got the right vocabulary. It takes a little bit of thinking there. Reapplication is an opportunity to examine one's file and portfolio, understand what happened. I think that sometimes having some help is beneficial. So a pre-medical advisor. Sometimes students will come to us in the admissions office to ask if we can do a kind of a post-mortem with them on why they weren't accepted. And sometimes we'll talk with them. It's a little bit awkward sometimes because it creates an impression of a quid pro quo. If I, as an admissions dean, tell a student that they need more shadowing, you better believe they're going to do it. But then they're going to expect that once they have more shadowing, that's going to earn them an acceptance at a school. And of course, I don't know what's going to happen any more than anyone does. So for that reason, it can be a little awkward, but a pre-medical advisor can be a wonderful person to have access to. Some students had notable deficiencies in their file, several categories of that. There may be not enough volunteering, not enough clinical exposure, not enough understanding of the healthcare ecosystem. There may be some kind of liability in their transcript. We don't have any kind of cutoffs or GPA minimum or anything, but nonetheless, I have to say the students who are accepted have a higher academic performance than the students who are not accepted in any given year. And, depending on exactly what your transcript looks like, that could be an issue. It's very rare for us to see a perfect transcript. If I had maybe just one or two take homes for your listeners, one would be that it's okay not to be perfect. Not only we don't expect you to be perfect, but almost none of our applicants are. All those people who are showing off on, online and talking about the great, 4.0 that they have, they're lying. It's actually very rare for us to see students with like a, perfect 4.0 type of GPA. And the ones who do probably didn't push themselves enough, potentially. But sometimes the grades are low. There's some things you can do to remedy that. If there's a course that really didn't sit well with you, you could retake it or take an advanced course in that area. Do something to show that you're willing to engage with the material. Some students who were not accepted on their first go around had the wrong school list. So they need to maybe do a little introspection with their pre-medical advisor and try to understand if there's a way that they could write their list to be more diversified and have a wider range of institutions and maybe align their school list a little bit better with their portfolio. Right? If you get the U.S. News and World Report magazine and you apply to the top 15 schools in that list. Obviously, U.S. News is a very controversial subject, but those schools are all very selective. They all have similar admissions heuristics. So I would anticipate a fairly similar outcome of your application at all 15 or 10 of those schools. If I apply to a wide range of schools, now I have the opportunity to discover how my application is going to land in different places. Some students will choose to, here's the major category. Some students will choose to do more schoolwork, either a post-bac or a special master's program or some online coursework. Some students will take more of a clinical position, shadowing, scribing, volunteering, medical assistant. That's all good. Some students will take a research position and do research for a year. Some will take a formal fellowship type of opportunity, maybe, I'll say a Fulbright scholarship, although those are not necessarily that easy to get, but some type of Teach for America. Again, you have to apply and be accepted, but a formal training program. Some students will work in a job. They'll work in, name any industry, consulting, something related to healthcare, kind of more of a 9-to-5 job type of position. The thing that doesn't work that well is doing nothing. And it's rare to see a student who does nothing, but we do sometimes see it. The applicant who thinks that the only problem with their application is that they were maybe too late, or they kind of zero in on one specific thing. It's a little bit of magical thinking. They conclude that they just needed to write something different in their essay. And so their plan for reapplication is to fix their essay. That usually doesn't work very well. We really look at reapplicants to see what they've done differently in the past year. Now, if you applied last year to WashU and this year to WashU, I can compare those two applications. If you didn't apply to us last year, but you did apply to us this year, I might need you to tell me what you've been doing. We do have a box for that in our supplemental application, a place where you can say what you've been doing in the time that you weren't a full-time student. But realize that we are interested in knowing how you use that precious year that you had available. I mean, it's great to have a year to focus on potentially nothing other than improving your med school application. Some students have other constraints. They need to work for pay. They don't have the luxury of indulging purely in application buffing for that year. We totally recognize, respect, and acknowledge that. And needing to work in a position where you're going to be, earning money to support yourself or your family is a totally valid way of spending the year. But keep one eye on what it means for your med school application and how you're going to describe it. But some of those could be great opportunities.
Thank you for that. I think that's so important that if you are in the phase of reapplication, don't necessarily get narrow, like-minded with tunnel vision of saying I only need to increase this one grade for this class, so I'm going to take this class. But you have an opportunity to do so much more, and not only just to boost your application, but to see if medicine is something that you actually want to do. I always tell students, if there's absolutely anything that you could possibly fathom doing besides medicine, try that first and then come to med school, because it will be there. It will be there. You'll be fine. Yeah. But taking that time to kind of self-reflect and see how you can increase your whatever deficiency you may have on your application. And then I also love that you said that comparison is not good. They're all the people, of course we have the social media, the med influencers and all of that posting everything, which is great. We need to meet patients where they are. They're on social media. As long as you're being respectful and disseminating reputable information, do what you like. But it's not always real. So and even if you are a star student and you're getting 4.0s and all of these things, you checked all these boxes, when you get into medical school, there'll always be comparison too. So someone may do very well academically, but not do so well on standardized tests and not do so great on their boards, or they may do wonderful on all of these things. And then when they get to the clinical realm, they may have difficulties with the connections and the bedside manner. Yeah. So just focus on what works for you and how you can improve your application and do well for yourself so that you can get to where you want to be is important.
Absolutely. Comparison is the thief of joy. You've heard that phrase. And we're not looking for students who are perfect. We're looking for students who have a lot of self-insight, who understand their own personal trajectory, mission, vision, goals, know what they're getting into, We're able to articulate their story. They can tell us why they want to do this. And we can see that they're driven to achieve in spite of obstacles they may encounter. And it's actually helpful to have encountered obstacles on the way. We're very interested in students who have resilience and grit. Those are important traits for success in a medical career because medicine's hard and it's going to take a long time to get from point A to point B. So resilience is definitely important to us.
Absolutely. And one of my final questions for you is something that's been floating around in my mind because there's been a lot of discussion about AI and everything. It's kind of like all the rage.
Oh, yeah.
So is there a role for artificial intelligence or chatbots and things like that in medical school admissions?
A role for chatbots in medical school admissions. AMCAS has, well, first, you're right. In the past year, everyone is talking about AI now. And I'm sure that we will receive application essays that were written with ChatGPT this year. It's not a question of if, but how many. AMCAS has revised its agreement this year to say that that's not allowed. So when you sign off on that, if you're an applicant, I would advise you to realize that the way it's phrased, you're not allowed to turn in essays that are the product of artificial intelligence. That probably doesn't guarantee that people won't do it, but there's an expectation on the school's part that you won't. There may be a role. I think that there have been ways for students to get assistance with their writing projects for years. It can be your sibling or friend who reads an essay and makes suggestions. It can be that program called Grammarly that advertises all the time on YouTube. Writing's not that easy. Grammarly can help. So the idea that there would be an assistive device for writing is nothing new. I have to say, the AI essays I've read have all been super boring, and it's very transparent that an assistive device was used. So I'm not that worried about someone using ChatGPT to write a great essay. One possible venue for AI that I was thinking about recently is that it could actually help a student to generate their school list. I think it wouldn't be wrong to ask ChatGPT what schools I should apply to. You can tell it all about yourself, and it can crawl the various information that's available about the missions of the schools, the location, acceptance probabilities, and so on. So you might have a conversation with ChatGPT and see what schools it would suggest to put on your application list. Schools are starting to think about whether they'll use artificial intelligence to screen applications. I can tell you that we're not planning on doing it. I don't actually know of any school that is actually planning on doing it, but it's sort of hard not to think about whether it could possibly play some sort of role. Right now, the application management or tracking platform that we use doesn't have any kind of AI integration, and so we're really not planning on doing anything. The problem with it is that sometimes AI makes mistakes, and of course humans make mistakes too, but I'd rather have human mistakes than AI mistakes. So for now, I don't see the schools using AI to make applicant decisions, but anything's possible.
Absolutely. And now my final question is one that I love asking all the physicians that I have on this show. If you had a magic wand and could change anything, not everything, I wish I could change everything, about the U.S. healthcare system because we know it's so perfect, what is one thing that you would change?
Wow. I always supported single payer. That's what I saw in Europe when I was growing up. France has a single payer health system. Now, there's still some embroidery around that because there's a level of co-insurance or sort of specialty insurance that citizens can take on. And so you do have a little bit of a two-tier system as a result. But what it does, single payer cuts out a whole layer of bureaucracy. And I think that there's a lot of waste. All of the paperwork and prior authorization and reimbursement. And I don't have to tell you how much paperwork and red tape is involved in healthcare administration. I think we have a lot of savings available. Most of those pieces of the healthcare delivery system are not really delivering value. A lot of them are focused on preventing people from getting care, and at least some of those people need the care that's being denied. So I'd like to see a lot of that stripped away, and the most obvious way I see for that to happen would be a single payer system. Unfortunately, our government bodies have made it pretty clear that that's not what they favor currently. So I don't know that that's one change. That might be many changes, but I would see something like that happening. One of we do have a mini single payer health system. It's called Medicare. So that's not a perfect model because the reimbursements are a little bit too low to support the whole system. But we've shown that we can do it in a very limited context. So hopefully not next time we have this conversation, when we talk about it again in 25 years, we'll be looking at our single payer system like the rest of the developed world.
I couldn't agree more. I recently saw a meme floating around social media. It was like, it's so fascinating that 32 out of 33 of the developed countries have figured out a way to have universal health care. I wonder what we could do. And we definitely know that no system's perfect, and each of the countries has their own little special tweaks to it. So hopefully over time, I hope it won't take 25 years, maybe 15, but it's been this long. We'll see what happens. So I really appreciate you coming and sharing all your words of wisdom for our students. I just want to give you an opportunity to say goodbye.
Well, thank you so much. No, it's been a lot of fun. And for everyone listening, I hope this has been useful to you. I hope you'll consider WashU, but I also hope that you'll consider making a broad list of schools, talk to a lot of different people, no matter what stage of your training you're at. There's going to be people who have been where you are just a little while ago. And so finding those near peers and asking them for advice can be really helpful. And so, Erkeda, thank you so much for putting this platform together and letting me be here.
Well, thank you so much for coming. So for all of the listeners out there, feel free to reach out and let us know if you have any questions, if there are any other guests that you would like us to have on, or any topics that you want us to cover. You can reach out on our Instagram at MedSchoolCoach, or my personal Instagram, Dr. DeGram, DOCTOR, the letter DGRAM, and just let us know what you're thinking. See you guys next week with another fantastic guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.